Hi, this is Dr. Young Cho. I'm a board-certified plastic surgeon and I practice here at Integrated Aesthetics, and I practice with my wife, Dr. Melissa Chiang, who's a board-certified dermatologist. So we would love for you to come to Integrated Aesthetics, and if you were to ask why come here, it's because of multiple reasons. Dr. Chiang is a board-certified dermatologist. I'm a board-certified plastic surgeon. We have a tremendous amount of knowledge and experience in the field of aesthetic medicine. We also have invested a tremendous amount in incorporating a number of different tools and devices, which is a big financial commitment, but it's also a big time commitment for us to learn and scour the industry of what is available out there and make decisions on what's the very best services to bring into the practice as well. And then we spend a lot of time with these devices and tools and solutions to really understand how they work and what we can do to optimize each device. Not the same device in 10 different hands may produce 10 different results and outcomes. We want to make sure that when we're using something in our practice, we're delivering the best outcomes for you. And most importantly, because we have a lot of tools, it doesn't mean that every tool is for you. You're going to be unique in your presentation, your concerns. It could be your skin type, it could be whether you have pores, whether it's pigment related issues because of sun damage. There's a whole differences of presentations for each patient, and we want to make sure that we come up with a customized plan where you're going to get results that you can see and be happy and confident with.
The reason why I think integrated aesthetics is at the forefront of medical aesthetics is because we offer so much. And so depending on the patient that comes in, they may need just a little bit of a non-surgical maintenance if they're in their 20s or early 30s. They might need something more like injectables or threads if they're in their 30s and 40s, but once in your 50s and beyond, you're probably going to need something more invasive. And so because we have all of these technologies, one of the things that I think we can do well is we can create the right plan for the patient. If you are a very small spa and you don't offer all the technologies, then you're not going to be able to create the wide range of plans. And when all comers are coming in, you're going to need to be able to suggest and implement different plans.
So like many of the services we provide here, we offer a full spectrum of options for our body contouring services. They span from the non-invasive to minimally invasive to full-on plastic surgery. So as an example, we do things like tummy tucks, we do lipo 360, we do the Brazilian buttock lift, thigh lifts, arm lifts, etc. At the same time, we do more minimally invasive approaches. We use Body Tight, and sometimes we're combining that with other energy devices to help tighten the skin, melt some of the fatty tissue areas, and it's a little more easier healing and less downtime than the full-on plastic surgery that are more incision-based. On the non-surgical side, we've developed a tremendous number of tools that address skin, muscle, and fat. We have several devices that help to shrink the fatty tissue there. We have devices that help stimulate the muscle to really rebuild and develop, whether it's your core muscles, your buttock muscles, your arm, calves, thighs. And we also have a number of devices that are focused on tightening the skin. Tightening the skin, we can do it with ultrasound, we can do it with radio frequency. These are different modalities that help to tighten the skin around there, and that can make a big impact. So if your conditions are more mild to moderate, then non-surgical options become a viable option. As they progress to more of a moderate to severe in their presentation in terms of whether it's the amount of skin excess that you may have, or the amount of fullness that you have, or if the muscles have separated because of weight changes or pregnancy, that's where the more invasive options will provide a stronger option. So when you come and visit with us and you visit with me, I'll be going through an assessment of what our starting point is. understanding what your goals and areas of concerns are, and then coming up with a list of potential options, whether they span from non-surgical, minimally invasive, to full-on plastic surgery.
At Integrated Aesthetics, we offer the whole range of injectable medicine. So what I consider injectables are neuromodulators, and those include brands like Botox, Dysport, and Xeomin, and then fillers. And fillers are hyaluronic acid fillers, like you probably have heard of Juvederm and Restylane families, but they also include biostimulatory fillers like Sculptra and Radiesse. And our goal with fillers is either to relax muscles, or to contour the face, or to add support. So those are all of the things that we can do with injectable medicine.
I would say some of the unhappiest patients that we've seen that have been elsewhere is where they go to a medical spa or a different business and they really only have one or two devices. And because they only have one or two devices, that becomes a solution for everyone that walks through the door. And often they're underwhelmed with a degree of change, whether it's truly been beneficial or not. If their expectations are up here, but visibly what the device can produce is down here, there's going to be this gap. And part of that expectation management may be, well, this device was never designed to do what you're hoping for, but we have other procedures or devices that may help you get there. So I think a lot of the misconceptions are that there's this perception that there's a one-trick pony that can help solve any aesthetic concern that comes in there, and that's simply not the case. It requires a tremendous amount of experience, a tremendous number of different tools depending on the presentation and the concerns that you come in with, and it really takes time to help educate you, the patient, on what your options are and what to expect from each of those options.